Hi, I'm just wondering if I could get an email sent to me because I can't seem to get it up on I can't find the Zoom on my computer, so I'm on my phone.
Yeah, could you put your email in the chat and I will ask my colleague who's co-hosting with me to send the link in to forward the invite from Access that is in a link.
Thank you so much.
Absolutely. Okay, folks, we're right at 10 o'clock, which is our scheduled start time. My name is Claire Courtwright. I am the policy director with Cal Voices, and along with my colleague Jocelyn, we're going to be presenting this training today. Just a little pre-housekeeping. Um, we do give folks a couple of minutes to join after our official start time. Because I know that calendar invite pops up for me when I'm joining Zooms, and then it takes me a minute or two to process and get online. So we're going to honor that. Just a bit of pre-housekeeping that I will also repeat, which is that this Zoom is being recorded. We do turn the captions on. And we do send slide decks after the presentation. And so given that we're making a record of all of this that will be accessible to you, we are not admitting AI note takers into these Zoom meetings for a couple of reasons. So folks that use that as an assistive technology, please be assured that we will make a recording of this available with the full captions on. Send the slide deck and any accompanying materials. But and we typically also send the oh, my brain. We will typically send a recording of the chat as well. So if there were Q&As in the chat, you will have access to those as well. But just to honor folks and their expectations of how their thoughts might be recorded and disseminated, because this is a public webinar, we're not going to do the AI note takers. And I hope that's acceptable to everyone. But I do also want to say, as an add-on to AI note takers, if you have a disability and you need some form of accommodation to access our content, let us know, and we'll make sure that you have the access that you need. Okay, we are right at 10:03. So I'm going to go ahead and get started with the presentation. My name is Claire Courtwright. I am the policy director for Cal Voices. I do have a co-host today. She'll introduce herself in part 3 of the training. Her name's Jocelyn Farrell. Just a little note about the Access program. The Access program is to empower local level advocacy. It's funded by the Mental Health Services Oversight and Accountability Commission. So Access is a program of Cal Voices, but any opinions as to policy are the opinions of Cal Voices only. Make sure my slides work. So as I mentioned, Jocelyn will be presenting the second half. A little bit about me. I am a person with lived experience of serious mental illness. I'm an attorney and I work primarily on state level policy. My colleague is also a person with lived experience and with a background in education and many other things, and a very talented presenter, and she will be part 3. So a little bit more housekeeping. We are scheduling this training for 2 full hours. The training is being recorded. We should have captions on. If anybody is unable to see those captions, please let us know in the chat and we'll make sure that we correct it if it's not working properly. The recording and the chat log will be made public, and by that we mean we typically post these recordings on our YouTube page. Cal Voices has a YouTube page. We also send them out to participants of the webinar. So slide deck, recording, any other materials that go along with it, including the chat, will be made public. Everyone is going to be muted on our end, and we will unmute you if you raise your hand in the chat as to prevent feedback in the meeting. We are going to pause regularly for questions and feedback. And you can put any questions that you have in the chat. We will monitor it jointly, but it may take us a minute to get to your question, but so that we don't zoom past a question that's relevant to a current slide. Jocelyn's going to be keeping an eye on that for me and letting me know, not being responsive to questions. Also, we are conducting a poll at the end of part 1 of this presentation, and that's just to kind of get a sense of who's here. So it's just sort of demographic information, you know, what county are you from, and that sort of thing. So we ask that you participate in that poll because it lets us know who we should do more outreach to and kind of get a sense of who's interested in benefiting from these presentations. So what in the heck is this webinar about? I'll reintroduce it if you didn't read the description. This is our community empowerment workshop. It is meant to give folks a sort of basic overview of a couple of things. One, it's meant to give an overview of what is the public behavioral health system? What do we mean by that? What is within the realm of the public behavioral health system in terms of decision-making power over the things that are going on in policy in California. The local level is actually the place where a lot of funding and some decisions land. So we're going to be talking about the public behavioral health system, why and to what extent it is actually locally controlled. And therefore, as folks that are doing advocacy at the local level, you know, where are your opportunities to advocate over where money goes, what programs get funded, that sort of thing at the local level. Even though things appear to be state level, they actually come down and they're administered at the local level. As part of that local level advocacy, there's actually a formal process in the law called the community planning process that's actually becoming increasingly important in terms of the types and amount of funding that are coming through that advocacy sort of small point, like toothpaste coming out of a tube. The community planning process is actually very important at the local level. So we're going to talk about what that is, your right to be involved in it and how to be involved in it. And then, so that's the first 2 parts of the training. And then the third part of the training is an interactive training for folks that are wanting to engage in advocacy at the local level. Because we hold these webinars open to the public, we don't assume any level of experience in local level advocacy. So to be inclusive of all persons that are coming to these webinars, it is a little more of a foundational training and less of an expert level training. So the interactive, but the interactive portion, which is the third portion of this training, is also an opportunity for folks that are really experienced in advocacy to speak up and share their wisdom with folks that have less experience with advocacy. So in that portion, you know, we're going to talk a little bit about, you know, how to, for instance, craft a public comment. If you're going to be speaking to decision makers, sort of like what's the best practices, the etiquette, the strategy of going about that. Okay. So why does any of this matter? Why do we care about local level advocacy? It's because you matter. There are 2 ways in which you matter. First of all, you know, for folks that are in the CEO's office, system level thinkers, people that are looking at things from a very high level, they often may not be fully in touch with or know what's happening on the ground. So the folks that are frontline providers, clients, family members in our public behavioral health system have a level of, they have a kind of knowledge and a level of knowledge that folks higher up the hierarchical chain may not know about. So you matter because you are people, us, the stakeholders are people that are supposed to benefit from these systems, but we matter for another reason, which is that our importance to these systems is actually recognized in the law. So there are places in the law where you have a formal right, us stakeholders have a formal right to be involved in this public behavioral health system in a lot of different ways, right? Not just the planning for the use of funds, but also, sort of who is going to provide these services that we're funding. Are those services working? When we're looking at monitoring what exists, whether it is serving us or not, how it can be improved, whether the services that we're providing are equitable across all of the populations we're supposed to be serving. Where money moves, what we call budget allocations, and much more. Another reason that local level advocacy matters is that it's a professional competency that certain paraprofessions are supposed to develop, specifically Medi-Cal peer support specialists, community health workers, promotoras, those of us who are providers in the system that maybe aren't the traditional licensed providers like clinical social workers or psychiatrists or psychologists. For us being able to advocate both for our clients individually, but also on the system level of how systems are working. That's a professional competency that folks are supposed to develop. And lastly, why local level advocacy matters is because these systems belong to us, right? These systems exist to serve and hopefully well serve the end user. And so unless that end user is influencing how things go, it may not be actually serving the folks it's meant to serve. It might be, fulfilling a requirement of a local government to provide a service. It may be meeting the government's needs, but it might not be meeting our needs. So part one is just a basic overview in California. What the heck is the public behavioral health system? So it's somewhat of a term of art that advocates in the system or Cal Voices uses. It's not quite a technical legal definition, but to have a shared understanding of what we're talking about, we are talking about services that are available to persons simply because they are members of the public within a certain jurisdiction, in this case, a county, that have a right to receive services that are funded by tax dollars. So they are publicly funded. And those services are being delivered, they're actually being given to the end user by a governmental agency. So we say they're public in that sense, they're publicly funded, they're delivered by government, and the persons that have a right to access them are people that are just citizens of the local jurisdiction. Typically, we do not include in this the carceral systems, any behavioral health, so substance use or mental health services that are being delivered inside the carceral system, so inside jails or prisons. The reason why we typically look at that as not part of the behavioral health system is partially just because those have funding streams that have not traditionally overlapped with the other parts of the system. So we kind of silo that out, although I will acknowledge that there's some new overlap happening, particularly in CalAIM. So what else is important to know about the public behavioral health system? I talked about toothpaste coming out, you squeeze the toothpaste tube, there's a lot of space up here, but it comes out in this small space. It comes out through this little choke point, right? So in California, the counties are the choke point where policy and money comes out. It's coming from way up here. It's coming from the federal government. It's coming from state tax revenues. It's coming from all these sources. This is all the funding and rules. But then it comes down to the county level, and that's sort of where things get made. And there are reasons for this. And one of the reasons for this is that Medicaid, which is the federal health insurance for folks with low income or disabilities, is in most states administered purely by a state agency at the state level. But in California, because California is so large and its counties are so diverse in terms of urban and rural, populations, needs, the state of California actually relies on its counties to carry out Medicaid. So what that means is your county is essentially acting like your insurance plan. So it's doing things that insurance plans do, like take in money, make sure there's contracts with providers. If you need a prior authorization, who's handling that? If you have a grievance, who's handling that? So really in California, um, it's the counties that administer federal Medicaid called Medi-Cal, which is 50% funded by the federal government, but then the state has an obligation to pay half of that benefit too. So it's like if you have private insurance, you're used to paying some of the premiums for your private health insurance yourself, and your employer pays some. So it's very similar with Medi-Cal. The federal government pays half of the cost to deliver that insurance to you, and the state pays half. And then also just just a note on terminology. In California, when the state gives the counties dollars to meet their federal share, non-federal share of costs, that's what we call it, it's called realignment. And generally the transfer from the state to the counties of responsibility over acting as that insurance plan is also referred to as realignment. So what does this mean in California? Again, because things are carved up out of this federal insurance program, we have what are called specialty programs. It's like a specialty insurance plan. So we have specialty mental health that is exclusively delivered by counties for folks with only serious mental illness. Folks with mild to moderate mental illness are in what's called managed care. But the specialty plans in California for serious mental illness, serious emotional disturbance in the case of minors, and substance use disorders are going to be delivered exclusively by the county. So again, you're seeing the counties be that kind of choke point. And then aligned with that have been other funding sources like the Mental Health Services Act, now being renamed the Behavioral Health Services Act through Prop 1. Those sources of funding were also sort of trained to be exclusive on the population with more severe conditions, serious mental illness, SED, or SUD. Even after Prop 1, which was passed on March 5th, we're seeing not only the money for Medi-Cal and health insurance come to this choke point in the county and be planned for in this choke point at the counties, but also Mental Health Services Act dollars, also opioid settlement funds, also any kind of quote unquote block grant from the federal government to pay for mental health or SUD, which we are now calling behavioral health. So those two components. Also, any source of local revenue around any kind of behavioral health services, they're all coming down to be planned for in that choke point at the counties through what is called the community planning process. So I'm already going too slow. A little more on the structure of things because it matters for local level advocacy. So I've already covered how the state delegates down to the counties certain things that the state would in other states does itself. So related to that is the state passes laws. We know this through its legislature. The governor signs them. The legislature is then allowed to assign to departments of the state the right to make further rules that clarify the laws, and we call those regulations. So I give this example, right? The legislature passes a law that says counties shall fund something called a full service partnership, and that full service partnership will include the full spectrum of community services and supports for people with serious mental illness or SUD. Because relatively vague, right? So then the legislature would tell California Health and Human Services Agency, which is a department of the state, or Department of Healthcare Services, which is a department of the state, to then, okay, you guys define what's the full spectrum of community services and supports. What's the definition? What's included in that list? Is it peer support and food, clothing, and shelter and day programs? So the legislature passes things that are relatively vague. It passes it down to the state agencies to give it more specificity so it can be carried out in real life. And then that process kind of happens again, where if there's still vagueness in the law or policy choices in the law, that will get passed down to the local level, to local agencies to figure out. So again, to like make that more specific, if the state agencies said counties shall fund housing and they didn't give a further definition, and then they pass it down to the counties and say, okay, counties, you have to fund housing. The counties may have discretion to say, well, what does housing mean? Does housing mean apartment vouchers? Does it mean boarding care homes? Um, so that's the kind of setup. And this is why local level advocacy matters. Counties are the choke point. Counties are also able to make some policy and make some decisions, and you can influence those. At the state level, we have official advisory bodies, boards and commissions that give input. At the local level, we also have boards and commissions that give input over what things are going to mean and which way things go, and you can be on those. So that's another reason that local level advocacy matters. So I have already kind of touched on this. This is just for you to review at your own leisure. It's like, okay, at the state level, what are the names and the functions of the big agencies that have decision-making power and official roles over how, rules around what behavioral health care will mean, rules around spending money. These are the folks that primarily have responsibility. And at the local level, this is an important point. There's lots of different local governments. There's your mayor, there's your city council. Um, in California, the public behavioral health system is it's not up to the city council or the mayor. The relevant local government is the county. And so the county has sort of a legislature or decision makers, and they're called the Board of Supervisors. So that's going to be the relevant local government that you would advocate to regarding behavioral health policies. And then under the Board of Supervisors, the county also has departments that do things, right? So the County Behavioral Health Services Department is going to be the primary entity that is delivering those public behavioral health services. Your county may have specific committees that have been officially set up to handle parts of the administration of the public behavioral health system, and I'll touch a little bit more on those. They might be called steering committees if your county has one. And then the counties are allowed to band together and kind of act like a super county. And we call those joint powers authorities. And in California, there is an entity that is set up that has authority to sort of act as a super county with respect to behavioral health services, and that is called CalMesa. So local level advocacy, we're going to talk about the opportunities and the access points. So again, an access point is who do you talk to? Where do you go if you are interested in local level advocacy around behavioral health services? Oh, I am supposed to stop for the participant poll. Thank you, Joss. I just saw that pop up. If you guys wouldn't mind completing this participant poll because I talk too much and I'm a little bit slow and we're have a hard stop at 2 hours. I am gonna move forward and hopefully it's not too distracting to multitask and quickly do that participant poll.
Real quick, Claire, there are a couple of questions in the chat.
Thank you also, Joss. Okay, can you unmute folks, Joss, and I'll take those questions.
The questions are in the chat box.
Oh, they're in the chat. I'm sorry. Okay, let me see this. Yes, slides will be sent out. Were RAP taught K-12, might there be fewer mental issues or addressing the sick person's disease after effect of? So I think there are some policy questions in the chat about kind of early intervention and doing wellness recovery action plans at an earlier stage. We usually do those with adults. I think that's a great point and something that, is a good point to raise with local level advocacy. We usually only do RAP at the adult level. Shouldn't we do it at the, shouldn't we do it for younger folks? Isn't it relevant? I think it probably is. And then there's another question, is the structure for serious mental illness and serious emotional disturbance or SUD programs funding changing with CalAIM? So that's a really good question. I will say yes and no. Specialty mental health and the specialty plans serving folks with serious mental illness, and the specialty plans, drug Medi-Cal, serving folks with SUD. My understanding is we're not eliminating those specialty plans. It's not a plan of the state government. However, some of the stuff that is in CalAIM on quote unquote the managed care side. So just again to a little bit clarify for folks, on the specialty plans, the county is acting as your insurance plan. On the quote unquote managed care side, where you're getting physical health care and you're getting services if you have mild to moderate mental illness, sometimes the counties act as the insurance plan and deliver those benefits themselves. Sometimes they subcontract with commercial health plans like Kaiser or Sutter. So folks might be like, I'm on Medi-Cal, but I have Kaiser. CalAIM typically refers to the managed care side of the house, but there are things that appear to be cross-cutting now, where folks who have serious mental illness and they're served through specialty mental health might still be able to have some benefits that are part of CalAIM. It's very complicated. I will give you that as a response, but also say that my understanding is that the specialty plans are not going away. You're still going to see folks with serious mental illness, SED and SUD served through those specialty plans and the counties. I think that's it. And I'm going to go ahead and move on if that's okay with folks. So again, what is local level advocacy? It means, locally to the county government, to the local players, advocating for your personal needs. If you are a client, if you are a family member, the needs of your family. If you are a provider, the needs of your clients. And opportunities to do that include informal things the counties are not legally required to do, but they may do, like surveys or listening sessions or places where they're creating opportunities for the public to come in and give them feedback. Local level advocacy also includes the community planning process, which is a formal legal requirement on the counties to include stakeholders in the planning for funds and services and much more. And then access, so those access points are going to be within the community planning process, at behavioral health board meetings, for instance, but also with the county board of supervisors, and that local government meets publicly about once a month. And that's a forum you can go to raise concerns. So this slide, I'm going to let you review this at your leisure because we're going to go into it in a little more detail. But this slide is really keyed towards what we call the community planning process, which again is a requirement in the law that the counties engage in. The community planning process is something that has to happen every 3 years, happens on a 3-year cycle. One of the changes of Prop 1 is that the county is going to plan for the use of funds once every 3 years. They may make some adjustments to those plans on a regular basis once a year, or intermittently, meaning not on a regular calendar basis, but somewhere in between. One of the changes is Prop 1 is that stakeholders, it used to be a requirement on the counties to engage stakeholders on those annual updates. So not just when the 3-year plan is being made, but during that 3-year plan. And that requirement is now gone. Counties can do it, they can choose not to. So this slide is really about the timing of when you want to engage in your local level advocacy to be effective. Because that right to engage in those 3 years where the plan is being carried out is now no longer mandated on the counties. You want to be involved right at the point that they're making that 3-year plan is initially being planned for, adopted. So what does any of this mean? So now we have this choke point, especially after Prop 1, where all these state, federal, and local monies to provide SUD or mental health services to the public are coming to this choke point of the community planning process and what they're calling integrated 3-year plans. So this is a look at the phases of that. There might be an informal kind of start that the counties do that's not part of their legally mandated process, where they reach out to you and they're kind of getting things ready to do their formal planning process. There is the formal planning process itself. Oftentimes, not everywhere, the counties will farm out the counties will farm out this legal requirement to engage in the community planning process to subcommittees called MHSA or BHSA steering committees, and that can be a one-stop shop for everything related to that planning process. Otherwise, if your county doesn't have a steering committee, you're going to be looking at your behavioral health board, previously called mental health boards, as the place most likely to be the one-stop shop or close to the one-stop shop for what's going on. So, there's this planning process where the community has a right to be involved. Then this plan is going to be crafted to spend money, who's going to deliver services, what those services are going to be. And that plan has to be published to the public for public comment for 30 days. Then the Behavioral Health Board has to have a hearing about it, whether it's a good plan or not. It has to make a formal advisement to the Board of Supervisors to approve the plan, and then the Board of Supervisors approves or doesn't approve the plan, and then it goes up to the state for another level of approval. So the important thing about these phases is to be involved early. And people are asking, okay, well, when does all of this really start? Like, what's the calendar date? So our 3-year planning cycle is going to start for the changes because all these policies have changed, and we have the Behavioral Health Services Act now, and we have integrated 3-year plans where all these funding sources are coming through this community planning process. When is that going to start in your county? There's been massive changes to the law. When does the county have to start engaging the public and doing this process? It's not defined, but I will say that my understanding is the state is asking counties to start this process and be prepared to start this process. The informal pre-phase one, January 1, 2025, coming up in a couple months. And then the formal process, the community planning process, about mid-year 2025. So the state is constructing enough new rules around spending and programs and services that the county should have enough information, enough guidance that's still being constructed by the state to be able to start that process with the public around the beginning of next year. And then those new rules, those new programs and services, all of that should be done and approved by about July 1, 2026. So if you're looking at that 3-year cycle and when you need to be involved, you need to be involved now. And stay engaged so that you can have influence as those plans are developed and the counties formally are done with it all by July 1, 2026. So that was a lot of talking for one slide. Someone asked in the chat, is Care Court involved in the county 3-year plans? It is not formally, but I will say people have a lot of questions around, how does things like Care Court, how are they involved in the spending of money? And I will say Care Court is not funded through these funds. But what happens in Care Court is the court is ordering you to engage in some kind of treatment. Take medication, see your psychiatrist, see your therapist if you have one, maybe go to a day rehab, a vocational rehab program, live in a certain place. And so the question is, who's funding those services for the people that are involved under these court ordered schemas, right? I'm ordered to be in a vocational rehabilitation program. Where is that being offered to me? And the answer is they're likely going to, there is no other, there's nothing else. So they're going to order folks in these court ordered programs into county services. So while Care Court is not officially involved in the planning process, it's highly likely, because there is no other source of services, that folks that are getting court ordered to be in services are going to come to the counties for that. I will get into, okay, I think some questions in the chat have been answered. I am going to go a little bit fast through this because it's sort of a little bit repetitive of what I just explained. The advocacy train, we will explain. So again, right, the counties can sort of pre-game this process. They can pre-game the community planning process. They can kick it off, and they are expected to kick it off January 1 because there's a lot more people that are required to be at the table in that planning process now compared to the past. There's more different types of funds that are involved in the planning process. So again, what are your opportunities at the local level? Because this isn't part of the formal planning process, kind of up to the counties. So you look to the counties to see what they're offering. You can also ask the counties to give you opportunities before the full formal planning process starts to take place, which we expect to happen somewhere around the beginning of next year. And you can say, hey, we want to give you we're concerned about programs and services closing. We want to tell you what we think those essential ones are. Even though we're not in the planning process yet, give us a forum to tell you this. You can make your own, so you can recognize, go Google. Where do you Google? Your county behavioral health department, your county board of supervisors. You're looking for Prop 1 implementation. You're looking for Mental Health Services Act, Behavioral Health Services Act, steering committees. What are you all doing? How are you engaging the community? You can also, show up at a board of supervisors meeting. They have what's called off-agenda public comment. That's where you're allowed to make a comment about things going on in the counties. It's not even on their agenda to discuss. So you should be on the lookout for opportunities that the county is not legally required to offer you, but may be offering you. You can also make your own opportunities. And that's the pregame phase. Then there is actually the planning phase. So what the heck does this even really mean? It's vague in the laws what the county specifically have to do to engage stakeholders, but they must have a meaningful engagement with stakeholders. Stakeholders means users in the system. It means family members. It means providers and other people. And because the Behavioral Health Services Act now includes funding for folks with no mental illness, but substance use disorder, because everything's getting mashed together into behavioral health, SUD, and mental illness. There's a real need and opportunity for folks with substance use disorders to be involved in the planning for these funds. So again, I mean, this is common sense, but because this planning process is probably going to take a year this time around to get that 3-year plan done, if you want something, you have to be involved early, because the more work that has done, the more consensus that has been reached in the community, the more decisions that have been made, the harder it is to change course. So a little bit about Prop 1, which, there's so much going on that we can't kind of go back to the beginning and take you right from the beginning on all of it, but there's many resources. The big changes from the Mental Health Services Act to the Behavioral Health Services Act in Prop 1 is that there's the ability now with behavioral health services funds to fund programs and services for folks only with SUD, whereas previously those funds were restricted to people with mental illness, serious mental illness, or a co-occurring SUD disorder. That is a major change. Another major change is that there's a mandate on counties to spend 30% of these funds on what they're calling housing interventions. That money has to come out of current services. Prop 1 did not make the pie bigger, right? So like funding is a big pie. It didn't raise the tax. We don't have more money. We just have to split it up differently under Prop 1. So, and also the big change to the community planning process is what's now being called integrated 3-year plans. What's different? What does integrated mean? It means the planning process used to only involve Mental Health Services Act funds, now called Behavioral Health Services Act funds. But the integrated 3-year plan process in Prop 1 requires the counties to plan for all the funds from the federal government, from the state government, locally, that are dedicated to mental health or SUD services. It's all coming together to try to align these funding sources and make sure that we're not doing things in silos. Could be a good thing, could be a bad thing. One of the big changes, there are a lot more suits at the table. There's a lot more people that are mandated to be involved in the planning process. They are not typically members of the community, although there is still community involvement, individual involvement. It's also like people that are running managed care plans. All right, so we got some Kaiser people at the table, people that are running, a little more law enforcement. There's a lot more sort of bigger system players that have to be at these tables now, and that's a big change as well. So I kind of touched on this. The law says the county must engage stakeholders in this community planning process. It's a lot of different funding sources now. There's a lot more people at the table. But what exactly does the county have to do with you in this stakeholder process? It's vague. They have to have a meaningful stakeholder process. They don't say exactly what they're supposed to do with the community. What they can do is spend money to go out and educate, find people in the community that are impacted and bring them in. They can spend money to educate you on what is this planning process? You know, what the heck is going on? How do I read a budget? They can educate you so that you can be meaningfully involved, something they can do with funds. But what is envisioned is sort of a dialogue, right? It's a sharing of information. The county's going to give you some information. We have $100 million to spend. These are the rules from the state around what we have to fund. This is what we have discretion over, what we can fund, what's optional. This is how we're going to make decisions. This is who we're thinking is actually going to provide the services. Maybe it's somebody that works for the county, or maybe we're going to contract with a community-based organization. Maybe we're going to contract with somebody else. There's supposed to be a dialogue, a sharing of information back and forth, and input from the community. So the county should be giving you information and giving you a forum to give them information back. Because it's not specific in the law what that's supposed to look like for the county, there's a lot of room to advocate for a more robust process, right? There's nothing in the law that says the county can't have 30 meetings about the planning process instead of 2. But unless you show up early and you kind of show up in force and you demand a robust engagement, it can dwindle. You know, if they set 10 meetings with the public, 2 people show up to the first one, nobody shows up to the second one, you think they're holding 8 more, they're not. Because technically they don't have to. And you know, where is the public accepting the invitation to be involved? So meaningful participation is what's required, but everything else is vague. So we kind of already touched on, you know, what is the CCP process? It's the process for spending all of these funds. And I already touched on the fact that the stakeholder community, the impacted community, only has a legal mandate to be involved at the initiation of that 3-year plan, the initial planning process of that 3-year plan. And then once it's in place and rolling for the next 3 years, you don't have a legal right anymore to be involved in how that thing might change. It's optional. You can demand that your counties allow you to be involved, but it's not a mandate on them anymore. Kind of already touched on this. If you just want to, I don't know, if you want to be like, hey, county, I read this is the legal language. Here it is. So we also touched on this. So what is this whole planning process? They might gear up informally. They will have to engage in some kind of dialogue, sharing of information, actually crafting what we're going to do, where money is going to go, who's going to be eligible, how are these services going to be delivered. And then again, it goes to the official advisory body of the County Board of Supervisors, now called the Behavioral Health Board, for them to, you know, the draft plan will get published online. It should be online, and give you 30 days to make written comment about it. There will be a hearing about it at the Behavioral Health Board. The Behavioral Health Board will take a vote to tell the Board of Supervisors, please vote yes or no. The plan will then go to the Board of Supervisors. The Board of Supervisors will have a public meeting where they vote yes or no on the plan. So again, the further you get along in that planning process, the more work has gone into it, the more decisions and consensus that has been formed, the less and less likely you are to impact the way that thing goes as you get further and further and further along, and to the point where the Board of Supervisors is taking a vote to approve it or not approve it. So again, yes, these slides will be sent out, and these are just graphical representations. If you know you're visual and I'm visual, what does this whole thing look like? Who's involved? Same, just a graphical representation. You know, there's the community planning process at the top, and then as you go around, you know, we have our plan. It gets locally reviewed. It gets reviewed at the state level and approved at the state level, and then back and back and back and back in a 3-year cycle. Steering committees, I also touched on this because the counties have a legal mandate to engage the community and have a meaningful community planning process. It's like, okay, who's going to do it? You know, who's going to take on this responsibility? It's a lot of work. Are we going to foist it onto, Barbara, who is running the front desk at Behavioral Health Services Department, or it requires so much labor that we're actually going to create a formal committee where people are going to be dedicated to meeting all the requirements of the community planning process, and it could be a one-stop shop in your county. Yes, that's what these are. If you need to Google it and see if your county has one. If your county has one, this is going to be your one-stop shop for the community planning process. We already talked about the local behavioral health boards. I will say very briefly, these boards are mandated to have consumers, clients on the boards. This now includes folks with substance use disorder and no mental illness. There are no maximum number in the law of members of this board. There are proportions of membership, but there's no maximum number. So if you want to be involved in an official advisory capacity to your county, you can try to be on your behavioral health board, apply to be on your behavioral health board. Again, Google it. Your county will tell you, here's the application, here's how to apply, and you figure out if you're qualified. They hold public monthly meetings. So again, this is a forum to give feedback. It's a forum where information will come from the county to members of the public. So we've already talked about the importance of being involved early. So the proposed plan it's kind of a product, right? It's a product of this dialogue and this assessment of this is the money, these are the rules from the state, here's what we think we're going to fund. And again, we've already kind of touched on this. So, there's all this work from the county and stakeholders and people that are mandated to be involved in the planning process, including all these suits. I don't mean to be disrespectful. Some of those suits are great, but there's a lot of different people at the table now. So, the finished product from that community planning process, from the community part of it, is that draft plan. Mental health board says yay or nay. Yay or nay is a recommendation to the Board of Supervisors, and then the Board of Supervisors takes a vote. And if you're coming in late on the game and you're like, oh my God, I just read this plan, it's actually terrible, and I want the Board of Supervisors to vote no. And if you show up at that Board of Supervisors meeting and you're like, vote no, just kick this thing back to be redone, that is hard to get done unless you show up with like 2,000 people and they're all mad about it. So again, the key is to just be involved early. Once the Board of Supervisors approves that plan, it's out of the county's hands, right? It just goes up the chain, state, make sure you did everything right, and we're rolling. So again, this is just, for your review, who the heck is the County Board of Supervisors? What do they do? So again, once this thing has been fully approved, so County Board of Supervisors says yes, the state makes sure you didn't screw anything up, they're cool with it. They're going to publish that plan, and then they're going to carry out that plan. So again, this is I'm a little bit short on time, and I want to get to any questions. So again, this is just, this is a lot of information, especially for folks that haven't been involved in it. So you can just kind of use this as a reference. And it's a little bit repetitive of what I've already said with a few more insights, which is, although there is a mandate for this stakeholder involved, meaningful community planning process, the reality is that a lot of things will happen behind closed doors, unless you really are there also demanding that process be meaningful and that the public be involved. So this is, again, just kind of a review, okay, phase 1 is kind of informal. That's going to start happening really soon. And then phase 2 is about the middle of next year. That's where you really have to be involved early and often. And so, phase 3 is where we're building that actual plan out. It's very specific. Money's going here. Here's who's doing what. Here's who's eligible. Here's who's we're trying to serve. So that's where the meat of the work is in phase 3. Phase 4 is that approval process at the county level. And then phase 5 is kind of okay, we've put it out to the public. This is what we're doing. If you try to do anything once it's already published, and it's just to use a term people use a lot, we call it implementation, right? So the plan says we are going to fund a day treatment program, and we're going to use a community-based organization to deliver that service. And then implementation might mean, okay, somebody figure out which community-based organization is actually going to deliver this service and cut a contract with them. So if you're trying to change anything after the plan has been published and we're already into the implementation stage, the only way you're going to be able to change something now is if it's like really whack, right? So like the example that I give is like, okay, the plan said that we are going to fund a day vocational rehabilitation program, and actually you just gave the money to the animal shelter. What are you doing? Right? So it has to be that messed up to be able to change anything this late in the process. Okay. So I think, yeah, I will take any questions that people have now. And then we'll take a little bit of a break before we're into Jocelyn's portion of the presentation. So I am checking the chat, but also please raise your hands if you would like to ask a question orally. And Joss, if you can help me make sure that we get to those folks. So Robert Hickman asked, how compelling is the input provided during the planning process to shape the decisions made by the local behavioral health department? This is a really good question. And I think it really depends, right? Like it depends on a couple of things. One, the planning process that we're about to go through in the middle of next year, the new planning process, the integrated 3-year plans, nobody knows, right? Because like I said, you have a lot more larger system players at the table. And kind of the idea from the state is like, we want to coordinate what we're doing with all these different funding sources, right? We want something cohesive out of all these different funding sources. And so it's like, this is a brand new process. Will the community be Will the end users, the clients, the families, the boots on the ground providers, the community-based organizations, the folks doing equity work, are they going to be centered in this process, or are they going to be kind of further marginalized because there's so many VIPs at the table and big system players at the table that didn't used to be there? I don't know the answer, but I will say, I mean, just with advocacy and governments in general, don't show up by yourself. You really need to phone a friend and make sure that if you're advocating for something, even if you're making a really, really good and compelling argument, my impression of governments is they kind of try to see how many people are in the room that feel the way you do. So I think for the community to throw its stake in the ground and make sure that the folks who really should be benefiting from these systems you're going to have to show up in force. And we just don't know yet what this is going to look like because it's changing so much. But thank you for that question. Anybody else? Any hands up? I am not seeing any hands up. And we do have time for a 7-minute break rather than 5. So we will take a break now. Every time I click outside my screen. So we will take a break now until exactly 11 o'clock, and then I will stop being the MC and pass it over to Jocelyn. Oh, wait, Robert has his hand up. Go ahead, Robert.
I am sorry to be so late with that. I was just wondering, are you going to provide information about how we can be in touch with that planning process so that we can begin early advocacy? I'm in Sacramento County, and I'm very motivated to try to have some influence.
Sure, absolutely. I'm in Sacramento County too. I feel the same way. I'm newer to Sac County, so I actually haven't been involved personally in the local level planning process. I mostly work on state issues, but I can say, okay, where do I get started for Sac County? You're going to want to Google the Sacramento County Behavioral Health Services Department and the community planning process and see what they've got going on. Every county is mandated to have what used to be called a mental health board, but as of January 1 will be called a behavioral health board. Absolutely exists in Sac County. I go to those meetings occasionally. So there's members of the community and providers that are on those boards. A member of the Board of Supervisors is on those boards. I think it's Patrick Kennedy here. Oftentimes lawyers from the county are there, and our behavioral health services department director in Sac County is Ryan Quist. He's there. So that's a great source of information about, what's going on and what's going to happen next. Somebody said in the chat, there are board seats open in Sac County, which is cool. So you can be on these boards if you wish. So those behavioral health boards are really, that's the big table around which all these extra folks are going to gather. The state has not given the counties enough information to implement the planning process yet, right? Like a lot of things are still being constructed. I'm going to comment on some of them today. I mean, outside of this webinar, but the state has promised the counties that there will be enough specificity about what they're supposed to do by the middle of next year to get involved. So you do have a little bit of time to figure out, what is the forum actually going to be. What is the forum actually going to be in Sac County to do this process? I'm not entirely sure if we have a steering committee, but again, you want to look for whether there is a steering committee. Is that enough information? I'm not sure.
Thank you.
Thank you for the question. So we're still on break.
Oh,
Hi, Claire.
Yes, I'm here.
Hi, this is Amber Glasser. Hey, I just want to let you know I have to jump off because I have another meeting, but I really appreciated being with your training for an hour. So, and I appreciate it. So I just want to let you know, okay?
Oh, thank you so much. Yeah, and it's recorded and it'll be posted and you'll get a copy so you can watch it at your leisure.
Excellent. You have a great day. Thank you so much, okay?
You're welcome. Thank you. Bye.
You're welcome. Bye-bye.
All right, so it's 11 o'clock, so we'll dive into our second half here. So thank you all again for joining us for this training, and thank you, Claire, for all that information. So here in this second half, we're going to be focusing on building advocacy skills and the more practical side of it. And there'll be opportunities here for some more interaction for you to put some things in the chat and come off mute and chat with each other here in this portion. So to start with, what are the goals of advocacy? Why do we want to go advocate in the first place? So advocacy can be a way to get your own personal needs met. It can be a way to get others' needs met. So you might be providing services to a particular community and seeing a gap in the supports and services that are offered. Advocacy can be a way to improve systems, services, and outcomes. And that might also include looking at outcomes in a new way. Oftentimes the outcomes that we as peers, as consumers, or as family members are looking at to determine how well a system is working are not necessarily the same outcomes that the decision makers are looking at. Another goal can be to promote recovery values, especially when we're working within systems that are more medically minded. It can be to advance the peer or the community health worker professions. And then what else? When you think of advocacy, what are the goals that come to mind for you? And feel free to drop this in the chat or raise your hand if you'd like. But when you hear advocacy, what are those initial thoughts or goals that you think of?
I'll participate, Joss. For me, when like just with all the changes that are happening right now, I just really want to track. I don't want to see clients lose services. I think it has to happen. I'm not sure. But for me right now, I think my primary concern is like if folks are going to lose services, that the county track it so that we can come back later and say there's not enough pie, there's not enough money, there's not enough services. So I think one of my goals for advocacy is just like accountability right now. I think a lot of people in the chats are saying expressing addressing disparities and advancing equity, which is very real.
Absolutely. Thank you for sharing. Yeah, advancing equity, addressing disparities in service provision. Absolutely. All right, so let's take a look at the traits of an effective advocate. So an effective advocate is strategic. They'll have a very specific goal in mind and know how to accomplish that goal. An effective advocate is an attentive listener. So advocating involves two-way communication. So that's going to require listening, picking up on clues around you. An effective advocate is empathetic. They can relate to other situations. They can show compassion. They can see things from different perspectives. They're a good communicator, and we're going to dive into that a little bit more later. They're collaborative. This work is not done in isolation, and part of being strategic also involves knowing when and how to collaborate with others to reach those common goals. They're observant, so watching trends, watching how people respond. Diplomatic. It doesn't matter how strong your argument is. In order to be effective, it needs to be presented in a way that's going to be well received by others. They're supportive. They're ethical, so they're living out their values and representing recovery. And lastly, an effective advocate is patient. So this work doesn't happen overnight, and we need to know that going into it. So the same way, like if you're going to plant a garden, for example, you're not going to put a seed in the ground and then go out there the next day and see that nothing's grown and get discouraged and give up, right? You go into it knowing that it's going to take time to see the results that you're looking for. And so similarly, when we do this advocacy work, we need to have that same kind of mindset. that it might take some time to see those results that we're looking for. So what are the qualities of a good communicator? There's 3 core traits that we're going to look at: credibility, confidence, and connection. And all 3 of these are going to reinforce each other. So credibility, do you actually know what you're talking about? And I want you to think of a time when you've been on the flip side of this. So perhaps you're a parent and somebody who's not a parent has tried to give you parenting advice. Maybe somebody outside of your field of work is trying to tell you how to do your job. And how receptive were you to this person? Right? More than likely, the fact that they didn't come with credibility or personal experience made you less inclined to receive what they had to say. So when it comes to the issues that you're advocating for, did you see or experience the issue or the event firsthand? And this doesn't mean that you can't still be credible without having that firsthand experience, but you may need to do a little bit more digging and research to get all of the information that you need. Do you understand how and why it happened? So to be credible, we need to understand not just the who or the what of the situation, but the why and the how of it. Do you know the factors and considerations involved in this situation? And then do your solutions or recommendations actually make sense? So are they addressing the root issue or just masking the problem? So how do we build credibility? We start by educating ourselves. So we need to understand agency and system rules, policies, procedures, and processes. We need to understand agency and administrative structure. So who's up the chain of command? We need to understand the processes in place for grievances, appeals, and issue resolution. We need to know the formal and informal power structure within an agency or system. So you can look at an org chart and that might tell you formally who's in charge, but oftentimes informally, there might be other people that have more influence. We need to know what kind of external forces the agency and system respond to. And then we need to know the consequences of escalating issues. So there might be times when we want to take something straight to the top to deal with it. And maybe that does work, but we have to consider what toes were stepped on in the process. Did we step over someone in a way that's going to make it so they're less likely to want to work with us in the future? So this isn't to say that it's never appropriate to escalate issues, but we really need to understand the risks and the consequences involved before we do that. So to establish credibility, first and foremost, get your facts straight. So take notes, document important details throughout the entire process. Research the issue. So get to know, why is it like this? What's been tried in the past? What's the history here? Make recommendations that address the underlying issue and don't just mask the problem with a temporary solution. Offer solutions that are relatively easy to implement. So if the solution is too hard, or even if it just looks too hard, people might not even want to try it. And then take personal responsibility for helping to make it work. So ask yourself, like, what can I do to be part of the solution that I'm recommending? The second trait is confidence. So can you convey your point clearly and succinctly? How certain are you of the facts? How certain are you of the rules, the policies, and the procedures? Have you practiced what you're going to say? And we're going to get into that more later when we talk about preparing to give public comment. Can you get to the heart of the issue quickly? So without beating around the bush or making it more convoluted? Can you explain your reasons and your values? And then can you connect this back to those values? And then lastly, can you handle pushback and overcome objections? So it's not a matter of if you'll face those kind of objections, but when. So we need to be ready for that and prepared for when it comes. So how do we build confidence? Verify facts, details, and information sources ahead of time. Write out everything you want to say and then simplify it over and over again. You can always provide more information when they ask follow-up questions, but we want to be able to get to the main point as quickly and as simply as possible. And then practice, practice, practice. You can practice by yourself. You can practice with other individuals. anticipate objections and how you'll respond to those objections. So a frequent objection might be something around like funding concerns, but we mentioned earlier that a good advocate is observant. And so if you've been observant and you're following the trends, you'll likely be able to anticipate what the most common objections are going to be. And then get feedback from a trusted source, someone that you can trust to give you an honest opinion. Advocate with other peers, community health workers, clients, and key allies. There's strength in numbers. I think Claire was talking about that earlier. A large number of people can communicate a stronger message. And then have a buddy present for moral support. This work can get discouraging at times, so it's important to have that person that you can turn to afterwards to get that support.
So, okay, so yeah, let's come.
So do we have a question there? Someone?
I think it was just background,
Okay, I'm
but
sorry.
if I muted Ms. Heath inappropriately, go ahead and come off mute, or I'll unmute you to ask a question, but it seemed like background noise, so
Okay, I
I just
apologize.
booped
Thank you,
it.
Claire. All right, so the third trait here is connection. So can you establish rapport in a way that can help motivate others to take action? So we need to consider not just what our message is, but how our message is going to be received by the other person. So consider things like, do you know what the listener has the power or the authority to do? Do you understand what the listener cares about? It's really easy to get so caught up in the things that we care about and that we're passionate about that we miss the opportunity to connect this to what they care about. Can you explain why it matters? Can you express yourself calmly without judging, blaming, or shaming? And this might take going through a personal internal process before speaking. And then are you open to new information and different views? And we want to be able to keep working with others to build these solutions. And so that's always going to involve multiple perspectives. So how do we build connection? Again, understand the issue from multiple perspectives. So that's part of being an empathetic advocate. Recognize what may be at stake for others. Again, being an empathetic advocate here. If you're advocating on behalf of somebody else, there might be more at stake for them than there is for you. It's important to be aware of that. Advocate with, not for or against. Look for win-win solutions. Focus on shared values and goals. So even if you have different solutions in mind than someone else, there's likely still some underlying values that you have in common. So look for those commonalities and focus on those. Make people want to say yes. Avoid making negative assumptions, so assume positive intent in others. Try to listen more than you talk and ask open-ended questions. And then when you're listening, listen to understand rather than just listening to respond with your argument. And then redefine winning. So you might have a lofty goal in mind, and maybe that's not going to get accomplished, but look for smaller wins along the way. So have you formed new allies? Have you strengthened your argument? Have you developed your advocacy skills? So there's always going to be those smaller wins along the way. So it's important that you recognize those. All right, so we're going to do a learning activity here. So you can raise your hand and come off mute. You can put this in the chat, whatever you prefer. But in this advocacy work, there can often be a lot of emotion involved. And that's a good thing because it can help drive our passion and our compassion. And also it does have the potential to undermine the work as well. So I want us to consider, how might someone's personal feelings undermine their credibility, confidence, or ability to build connection? How can you tell when someone's feelings, their personal feelings, might be getting in the way? And what are some specific actions to overcome this barrier? So feel free to raise your hand and come off mute. Feel free to put it in the chat. I'll give you a few moments to do so. But yeah, share your thoughts however you're comfortable. And I know it takes a little bit of time to type, so I'll give you a minute here. Yeah, not being able to remain objective. Yeah, it's very easy to become subjective and biased. So do we have any hands
Could
raised?
come off chat.
Yeah, go for it.
I don't like typing. People getting emotional when they talk, getting
Mhm.
really passionate, maybe start to stumble with what they want to say, not being clear with their message. Because they do have a lot of emotion tied to what the subject matter might be.
Mhm. Absolutely. Thank you for sharing. And then Claire in the chat, noticing audience members, participants, insulting the board that they're talking to. Yeah, that's going to undermine that rapport and connection really quickly. And yeah, makes their statements less worth listening to. Not knowing the subject matter well. Let's see. Yeah, what works for you doesn't always work for your person served. Yeah, important to be aware of that. Yeah, Robert, I can see you're raising your hand. Go ahead and come off
Yeah.
mute.
Yeah, being emotional about a subject can detract from the truth of the message.
Absolutely. Yes. Thank you. And Kimberly, yeah, scolding, virtue blaming. Yeah, so definitely something that we want to be aware of. Because like I said, it does involve emotions. This work is always going to involve emotions, but it's something that we just want to be able to keep in check.
I really like this that Emily put in the chat. I think she's talking about overcoming the barrier, removing false narratives and assumptions. I love that. Thank you, Emily.
Absolutely. Sorry, I missed that one in the chat. Thank you, Emily, and thank you, Claire. Yeah, so let's, we're going to take a look now at 6 steps for effective public speaking. So a lot of this we've already touched on, but understand the issue, do your research, understand it from multiple angles, develop a strategy and a plan that's solution oriented, select a forum, get to know your audience, understand meeting guidelines, so how long you'll have to talk, when you'll be able to talk, any other guidelines, and then make your point. Notice that making your point is the very last step here. It can be really easy to want to put the cart in front of the horse and just get out there and make the statement, but it's important that we slow down and follow these steps. So number 1, understand the issue. So how common or widespread is the problem? Is it affecting just you, your client, entire communities? What are the actual or the potential impacts of the problem, both immediate and long-term? How did we get here? What has already been done and why? What hasn't been done and why not? What might work and why? And what competing interests might be at stake that could be an obstacle here? Let's see, looking at the chat here. Oh yeah, thank you, Claire. There's the worksheet that will be coming that will match these slides. So we're going to do another learning activity here. Again, you can come off mute, you can put this in the chat, but how might not understanding the issue well or not knowing the context, so the players, the systems, the rules, undermine the effectiveness of a public statement? And how can you tell when someone doesn't understand the issue or the context well enough to speak about it? And what are some specific actions to overcome this barrier? Yeah, Gina, I see you have your hand raised. Go ahead, you can come off mute.
So as far as the issue is concerned, you should know what you're advocating for, as well as the pitfalls of what you're advocating for. And data always helps. And then to tell if someone doesn't understand the issue is if you ask them a question and they cannot come up with an answer. And the specific actions to overcome, again, know your numbers, your audience, build alliances or get to know the people that sit on the body or the board and what's important to them as far as what they generally base their votes on. Is it data? Is it sentiment, emotions? What drives them to do or go either way? And I think that would be a good starting point.
Absolutely. Thank you, Gina. Yeah, getting to know your audience is super crucial. And I like that you mentioned too about when you ask a question and they're not able to answer, because that might be the reality sometimes that people ask you a question and you don't know how to respond. But it's definitely better to admit that you don't know rather than pretend that you do. and try to like fake an answer. That's going to erode that credibility a lot quicker than just admitting when you don't know something and then going and doing your research afterwards. See any other hands raised? I think that's it. All right, so number 2, the second step here is develop a strategy. So identify what goals you want to accomplish, and then what is the best way to accomplish those goals. Identify who can help make things happen. So are there allies? Is this an opportunity for collective advocacy? How can you get it done? Where can you start? What are the next steps? What are the challenges? And next, we're going to select a forum. So which public agencies or entities have authority or influence over the issue? And then how are these agencies or entities responsible for the issue? So are there laws that make them responsible? Are there internal policies that make them responsible? Then consider when and where you should make your public statement. And then what is the best or most appropriate forum to make your statement? I see in the chat here from Stuart, what about practicing before trusted friends with a stopwatch? Absolutely, yep. You only have a short amount of time, so getting it within that 2 to 3 minutes is super important, and then having that trusted friend that can give you that honest feedback is super crucial as well. So we're gonna watch a short video here. And so as we watch this, I'd like you to be thinking about how well the speaker understood the issue and then how well she understood her audience.
Hey, I'm not sure. Could you say your name for us, please?
Xanthi Paharillo.
Yeah.
Hi, everyone. First, I want to thank Madam Mayor and the council members for your time. I prepared a little statement. I'm here on behalf of the Santa Clarita foodie community. And I was wondering, is there a Spanish translator available by any chance? Just to not exclude the Hispanic community?
No, usually we try to do that in advance.
Okay. So I'll just get into it. In 1982, a boneless barbecue pork sandwich was introduced to the United States, and it was available for only a limited time during the fall, which is called the McRib. But this year, McDonald's, they decided to give regional managers the power to decide whether to sell the McRib at their locations. And apparently only 55% of McDonald's franchises nationwide have chosen to sell the McRib, which means 45% have decided to skip it, including the Santa Clarita area. And there are 10 McDonald's here in Santa Clarita, and none of them are selling the McRib. And specifically the McDonald's on Shaquilla Lane next to In-N-Out is not selling it, and it's been replaced by an all-day breakfast, which I think is like a really poor substitute. And consumers have had to resort to the McRibLocator.com, which gives disappointing results if you use it because the nearest sandwich was seen in the Bay Area.
No, could you go
be
through the
honest,
bags? Because I brought some stuff for the house too.
Removal of the McRib from the menu has affected my family because every Thanksgiving, my family would like order a 50-piece chicken McNugget and like 10 McRibs. It was like a tradition in our family. And now it's like, well, like my family's holiday spirit's kind of messed up and broken. So basically what I'm trying to say is like, I come to you in this matter that I hope you members of the council can help and speak to these McDonald's managers, because I tried calling the hotline and they like don't take me seriously. So I don't know, to me, like Thanksgiving for my family without this like McRib is like a Christmas like without snow. It just doesn't make sense. So thank you for your time and listening, and happy Thanksgiving.
Hey, Miss, I'm not sure.
All right, so let's chat about this here. So what issue was the speaker addressing? Yeah, Robert, you might need to try out a new Thanksgiving tradition here with the McRibs. Yeah, so the issue here she's focusing on is the McRib is not available. Exactly, Kimberly, the scarcity of local McRib availability. And how well did she seem to understand the issue? Yeah, I would say pretty well. She had her data there. She knew about the McRib locator. She had the statistics about how many McDonald's were carrying this. And then what was she asking the city council to do? Yeah, it's not super clear. Seemed like she was suggesting that maybe they could somehow call McDonald's and change this. Yeah, contacting McDonald's managers with her request, support her cause. Yeah, but it is a little bit vague what she's asking. What authority does the city council have to resolve this issue? Yeah, absolutely none. These are McDonald's franchises. They have no authority over this matter. And so then in light of that, was this the right forum to address the issue? And why or why not? Yep, seeing a lot of no's in the chat. Not the appropriate forum. She's not aware of the process for her request. Yep, because they don't have the authority. Wouldn't a board like this deal with private businesses all the time? Thank you for that question. I don't know, Claire, if you can speak on that with how the boards work. I know
Yeah,
this is talking about franchises, but you might be able to speak.
I will say, if anyone was giggling and feeling guilty about it, you are not laughing at her, you are laughing with her. She's actually a comedian, and she showed up at the county board of supervisors on purpose to sort of have fun for the holidays. So she is actually a comedian, and that's why it's a little bit ludicrous. But it's also a good example, a lighthearted way to look at public comments and why they might be appropriate or inappropriate. So yeah, I mean, so I think somebody's asked is like they're trying to figure out, does the board of supervisors have authority over this issue or not? And that's exactly how you should think about it when you're thinking about yes, she was trolling them, Kimberly, correct. But that's exactly how you should be thinking about your public comment. And it's not an inappropriate question. It's exactly what you ask yourself when you're like, what do I want these folks to do? So if you are deciding what's the appropriate forum for your advocacy, is the appropriate forum to, call this McDonald's manager number, or is the appropriate forum to go ask the board of supervisors to do something? That goes back into the conversation about credibility and confidence, right? Like you got to go figure it out. Can the board even do the thing that I want them to do? I want my board of supervisors to ban a piece of algorithmic rent price fixing software called RealPage. And I did my research, and I know that they can because the San Francisco Board of Supervisors did. So like, there's an example. I didn't know. I was like, what can they do? So I went and I tried to see if anybody had done anything about it before. San Francisco had. And so then when I asked them to do it, I'm not done asking them to do it, but when I asked them to do it, I was like, hey, San Francisco did it, so I think you guys can too. Tell me why you can. Long-winded answer. Back to you.
Thank you, Claire, for providing that clarification on that. But yeah, it seems like overall we agree this was not the appropriate forum, and that is why it is so important to find what the appropriate forum is when making these asks or these statements. Which leads us into knowing your audience. So what are the political backgrounds or leanings of the decision makers? What do they care about? How have they voted on similar issues in the past? What arguments might be most convincing to each decision maker? And if these are elected officials, all this information is going to be really readily available for you. But even if they're not publicly or elected officials, a lot of this you'll still be able to find just going online, Googling the person. You can still get quite a bit of information that way. And then number 5 is understanding meeting guidelines. So when, where, and at what time is the meeting or hearing? Is your issue on the agenda? If not, you may need to make a general public comment. And that's just going to get lumped together with all the other general comments. How much time do you have to speak? Often it's going to be around 2 to 3 minutes, which isn't a whole lot of time. And I think somebody mentioned earlier about making sure you have a stopwatch when you're practicing. So yeah, it's super important to get that timing down. And then are there any other procedural rules this body follows that you need to keep in mind? So consider open meeting laws. At the local level, that would be the Brown Act. At the state level, that would be the Bagley-Keene Act. Consider county ordinances that govern where, when, or how often these meetings take place. Consider bylaws and Robert's Rules of Order. So the Ralph M. Brown Act, again, this is for the local level. It states the people of the state do not yield their sovereignty to the agencies which serve them. The people in delegating authority do not give their public servants the right to decide what is good for the people to know and what is not good for them to know. The people insist on remaining informed so that they may retain control over the instruments that they have created. All right, so in short, what does the statement mean? Right, essentially, it gives us the right to be informed. So local public agencies must post notices of public meetings and agenda items at least 72 hours in advance. They must make meetings open to the public and provide opportunity for public comment. They must share meeting materials and other documents that they rely on to make these decisions. All right, and that brings us to number 6, the final step of public speaking, and that is making your point. So as I've mentioned, you'll often only have 2 to 3 minutes to give comment at public meetings. So that's not a lot of time. So you're really going to need to plan out in advance what you want to say and then be able to make those points quickly. So in that time, you'll be able to do an introduction of about 3 sentences, the substance, about 7 to 10 sentences, and a conclusion of around 2 sentences. So altogether, that puts you at around 12 to 15 sentences, about 20 sentences at an absolute maximum. So in your introduction, you're going to state the issue or the problem that you're going to talk about, and then state exactly what you want the body to do. Sorry, I think I missed the first one. I was stating who you are and where you're from, sorry. And then get into the issue or the problem. And then for the substance or the body of your comment, how is the issue impacting you, people close to you, people like you, or the community at large? Why is the current situation not working, or why is the proposed action ineffective? What is a possible solution? And why is this solution better than the status quo or the proposed action? And you'll want to spend about 3 to 4 sentences on this part, and make sure that you have facts and data to be able to back this up. Afterwards, you'll get to the conclusion. So in your conclusion, you want to restate your ask. So remind the body exactly what it is that you want them to do. And then thank the body. Remember, we want to be able to establish rapport and maintain that connection. So small things like thanking them, super important. And a few other tips for crafting your public statement. Consider or concisely present the benefits of adopting the change you're recommending and the risks of not adopting it. Be clear and direct in your reasons and requests. Use I and we statements as opposed to you and they. Avoid blaming other individuals and agencies which can erode that connection and cause people to become defensive. And then don't call people out by name. So if possible, use their title or position when you're referring to them. And it's also important to consider the impressions that we're leaving. And I want you to consider why. So you can put this in the chat or can come off mute. But why do impressions matter? Or another way to think about it is like, what could go wrong if you leave a bad impression, bad first impression? Credibility. Yep, your credibility is at stake. Absolutely. They're not going to take you as seriously. You won't be viewed as competent. Yeah, absolutely. So that first impression is super crucial. Yeah, they're not going to want to engage with you again or listen again. They'll tune you out. That first impression is credibility. Yep, that's when you're giving them, you're showing them your credibility for the first time. So it's important to ask, what do you want people to say about you after you've made your public statement? So for example, when I finish public comment, I might want people to say that Jocelyn is knowledgeable and well-informed about this particular issue. So then I need to ask myself, what can I do so that people will say that about me? So in my case, I could research the issue thoroughly. I can talk to others who have different perspectives so that I understand it from multiple angles. And I can practice my statement multiple times in advance. So identify the impression that you want to leave and then identify action steps that you can take to ensure that you are leaving that impression. Some other factors to consider. Who is my audience? So we've talked about that a bit already, but consider things like timing, setting, cultural norms. How much should I say? So if I have additional information I want to add, is it going to strengthen my argument or is it going to detract from it? And then why am I saying this? So 3 questions I can ask myself are, is this relevant? Is this helpful? And then who does it help more, me as a speaker or them as a listener? And if it's more helpful for me than it is for them, then it's probably not worth including in the statement. And sharing your story skillfully. So there's times when sharing bits of your story can be really powerful. So it can help build connection, it can help build credibility, but it needs to be done really strategically. So when you're sharing your story right, it should inspire hope towards recovery. It should build mutuality and promote equality. It should create trust with your audience and help build that connection. It provides a model for change. It can reduce stigma, and it can promote personal empowerment. But again, this needs to be done really carefully because sharing done wrong can be very detrimental. So it can discourage hope if you're focusing too heavily on the negative details. It can reinforce power imbalances. It can trigger or re-traumatize others if you're giving too many details that are unnecessary. It can keep people stuck instead of promoting empowerment. It can increase stigma. And it can decrease your credibility rather than increasing it. So again, we're going to chat as a group here. What are the pros and the cons of disclosing details of your lived experience to an audience of strangers or decision makers? And then how can you share your story in a way that helps to reduce stigma rather than reinforce it? Feel free to raise your hand if you'd like, but it's easier to share that way. Or put your thoughts in the chat. Yeah, credibility. So either way, it has the potential to build that more credibility or decrease that credibility. Stigma as well, stigma and credibility. Yeah, so how can you reduce that stigma instead of reinforcing it? You can recognize when you're oversharing. That's where practice is really important, practicing with another individual beforehand. Yeah, oversharing can be uncomfortable. It can be uncomfortable for the person doing it. It can be uncomfortable for the people that are hearing it. Just sharing in a professional manner, rather than one that might be aimed to ridicule, can help reduce stigma. Yeah, I see your hand up. If you want to go ahead and unmute.
Hi, thanks. I think sometimes people in these kinds of positions are so far away from the issue and the people that they are making decisions about that it helps to be like, I'm one of those people. Like I've been through this thing or I had that experience or whatever else. Kind of humanizes the decisions.
Absolutely. Yeah, I love that, humanizing it. It can be very easy to look at these things just as issues, rather than as people. So being able to put a face to it, can be very helpful. Yeah, it can be painful to share. Rule of thumb, scars, not scabs. I haven't heard that before, Kimberly. I like that. Scars, not scabs. Right, yeah, thank you for sharing all of that. So a few more tips that we'll go over here. Dress the part. So, be clean, be professional, remain positive, make eye contact as much as possible. So you can have your notes, have your statement, but try not to read it entirely. Use a conversational tone, as that helps build connection. And that'll come more naturally the more that you practice. Consider a first person statement to help build connection. Focus on just one issue at a time. Offer solutions. So our community can sometimes have the reputation of coming in with just a lot of complaints or negativity. And so we want to make sure that when we're coming in with solutions that we can offer. And then submit a written copy of your statement if possible. Again, practice is super essential. So what happens when people don't practice? People who don't practice their statement are more likely to overshare. And we've just been talking about how detrimental that can be. They tend to ramble. And when you only have 2 to 3 minutes, there's not time for that kind of rambling. They tend to dwell on the negative. And they're more likely to regret their choice of words. And then lastly, they're more likely to experience strong emotions that may interfere with their message. So like we talked about earlier, when those personal feelings get in the way and can undermine your credibility. All right, so we're going to look at one more video here. So another example of somebody giving public comment, and then we'll discuss it in light of what we've been talking about here.
Hi, my name is Aaron Lanieve, and I think that this whole thing is the most ridiculous thing I've ever had mess up my newsfeed. First off, this is the United States of America. We have a First Amendment constitutional right to say what we want. That includes you. You were elected to talk trash to the crazy cat lady. It's the truth. I'm so sick of the way this town gets run. It's disgusting. The police are usually out of control. Nobody says that. It gets whitewashed with this crazy, like, oh, you can't say it like that. You got to watch your P's and Q's. No, it's the United States of America, and you can say what you want. What don't you get? What don't you curmudgeons don't get about that? It's the fundamentals of how this country was founded. It was founded on crazy people saying crazy things to each other. Personally, I think you should have taken a key from George Carlin or Eddie Murphy. But hey, it's boring, whatever. The news in this town, I make a comment about the news. The pantograph is the most slanted crap I ever heard. Somebody started a page the other day called the slantograph. The flamingo flockers, man, to tell you the truth about the flamingo thing, I would have gotten penguins or expanded the bug exhibit, but they don't make no sense with fist bump over there bumping his fist with his fist. And, you know, the only decent news in town is GLT. Seriously, if we're going to advertise the radio stations and such, well, let's talk about the jazz radio station. I learned about Bo Dallas the other day on American Roots. Great Louisiana music. Is great. And that's what I'm getting here. I'm getting garbage over here, and I'm getting really good tunes over here. And they kind of talk about the important stuff. And I'm really sick of the nonsense because, you know, most of the Republican nonsense, Ronald Reagan worshipers, you know, like they don't make any sense. And I'll leave you guys with a quote from George Clinton. Free your mind and your ass will follow.
Hey, excuse me, but
All right. So, was the speaker addressing an agenda item or making a general public comment? And how can you tell? Yeah, he did not state it. Rambling. Yeah, general comments. Yep, public general comment. And then what did the speaker want the city council to do? Yeah, not sure, no idea. I've listened to this so many times, and every single time I keep thinking that I might understand a little bit of what he's getting at, and I still have no clue what he was getting at here. Yep, Kim, yeah, the emotions took over, the issue was not clear, too many ideas, talking about too many things at once. How do you think the audience perceived the speaker? So I think those first impressions. Yep, he was dismissed due to no credibility. Right, then comical. Yep, you can kind of see it in the faces of the people in the audience. Did the comment relate to the council purpose? I have no idea. It doesn't seem like it, right? It just seems pretty nonsensical and rambling. And then how might have following these steps that we've been talking about here, these steps for making a public comment, how might that have helped him in this situation? So the steps we've talked about of knowing your audience, knowing the forum, practicing in advance. He would have known himself what he was actually asking for. Exactly. I'm not even sure if he knew what he was asking for. Everything, yeah, pretty much sums it up. Yep, maybe he would have actually made sense. Absolutely. Yeah, so prime example for why it's so important to take the time to practice, to go through it slowly, to know what it is you're advocating for, knowing who it is you're advocating to. Yeah, he might have noticed his own information more. Exactly. Yeah, so there is a worksheet that does go along with it. Basically, all these steps that have been outlined in the slides. I think Claire mentioned this earlier in the chat as well, that will be made available with the slide deck and with the recording. So you'll be getting that as well, just a handout that follows along. these slides and those steps. But otherwise, that brings us to the end of our discussion here. So I want to thank you guys for joining, for participating, for all of your engagement. I really appreciate it, especially in the second half with more of these discussions. I really appreciate your engagement and involvement with that. But we do have time. We have about 10 minutes left. So if you have any follow-up questions on any of this or the first half that maybe we weren't able to get to, yeah, feel free at this point to ask any questions you might have from today's presentation.
Or since we have 10 minutes left, I know it seems like I was chatting with some folks that people might want to ask each other questions. It seems like there's folks that are engaging in some advocacy and they feel frustrated by not making progress, and they're kind of trying to rejigger and figure out like, okay, where do we go from here when the things that we're doing aren't working? So if anybody wants to have that discussion a little bit publicly, or really anything else, if there was any part of the presentation that you're like, I want a little bit more, I want a little bit more, detail on something, we're happy to hang out, but you're also free to dip out at any time you like.
I see Kimberly's comment in the chat about what tips might you have for the storytelling portion. I know we have a lot of people in the audience here that have experience with that. If anybody wants to share on that for Kimberly's question. Yeah, go ahead and you can unmute yourself. See your hand raised.
Thanks. Hi, my name is Elsie. As far as storytelling goes, I've had some training and some experience sharing my own story of like my mental health journey, like recovery and all that. And what I found most helpful is to try not to get wrapped up in like, this is my story, I want to tell it. But to get motivated by like, what's the message? Like, what does somebody need to hear from this story? Like, they don't need those details, probably, right? But if I'm trying to communicate that things can get better, like recovery, like standard kind of recovery stuff, I might need to like hit on those points a little bit about like how bad things were, but not like I'm like resisting doing it right now, but not the little tiny details of it. And also, I also already did this in speaking, but this one, what's really helped me is to make the point and then stop. Like, I'm always somebody who is like, oh, let me clarify a little bit. Let me like, oh, I said that a little bit wrong. Let me rephrase it. But it's in my experience been best to just like get it out there. People take it, they don't take it, whatever. See, like I've made this point like 3 times already in the last few sentences, and people stop listening, or they already heard it, or like they got what they're gonna get. So sometimes saying less in general.
Yeah, thank you, Elsie.
I love that. I love that comment. And I've been thinking about something kind of along these lines too, because I'm so used to talking to sort of my in-group or members of my community about the nature of our experiences, and they really are our experiences. And then I talk to people who just have not, like policymakers, and they don't have a lot of connection to this. And you don't even realize that like you're speaking with a level of familiarity and assuming a level of understanding, but it's not there a lot of times. And so, I really like this thought around, not telling some people something they've heard before, but also like, how do we, because we're so used to telling our stories in safe spaces or amongst ourselves, like how can we become aware of what it is that people don't know, don't realize they don't know, and like share our stories intentionally as like education, but also an opportunity for people to develop some empathy towards us, sympathy.
I agree with Don there in the chat about watching the acronyms. There can be like a whole foreign language here. So being aware of that.
You know, at the risk of like speaking too much in this meeting, like somebody stop me if you got something to say, I'll step back. But it was me in the chat asking about like, what do we do then? Like I did so many other things in like the checklist section. I was like, yep, did that, did that, did that. And I'm not getting that a response. Like literally not getting the response, any response. And I'm really questioning if like when is it time? I know this isn't about like how to do that part, but when is it time to like do something else? And I think maybe more importantly to this discussion, if that's me, like I've been the one doing this kind of diplomatic advocacy thing. Um, I don't want to ruin my credibility on that angle because it may be necessary by doing the kind of more activist actions and planning that and like being maybe a face or figure in that space. So I'm wondering if people have experience navigating like these two different channels of getting these changes made.
I think we were kicking it in the chat a little bit back and forth about that. And I don't know that, you know, there are like easy answers, but I will just say, I think like all marginalized communities are dealing with that because the pendulum swings back and forth. Sometimes it seems like policy is going in a direction that's good for your community, and sometimes it feels like it's rapidly going in a direction that's bad. And when it feels like the diplomatic, it feels like the deck is stacked against you, and the diplomatic response isn't it isn't moving the dial. And then, yeah, I just want to sympathize again. I mean, I know we were chatting, but I just want to sympathize again with the problem of like, when do you become more of an activist? And I've seen lots of friends that do like organizing and work for communities outside of this space. And I've seen them go through that too. It's like, oh, we got this like we used to have politicians that we had a level of like rapport with, or like a level of common shared values, and then some election happens, somebody else comes in, and we're like, do we, you know, like we don't like the way this person is talking about our community, or they're taking actions that are really harmful to our community. You know, at what point do we just start calling them out on Twitter? You know, and I just want to acknowledge that that's like it's a hard decision, and I don't know that there's a right answer to it. It's more like there are benefits, there are risks, and rewards on either side. But I mean, I guess I just fall back on like a level of authenticity. Like we all know somewhere how important the issue is. And it's like, what do you need? Do you need, you know, a $30 minimum wage for IHSS workers, or is what your community needs, like, you know, to not be criminalized and not be arrested? It's really, it's a personal choice. Um, it's a personal call on where you feel like how severe the issue is, you know, where things are landing. And you know, I think, I'm not sure who else I was chatting with, but I was like, there is a whole history in the disability rights movement of not being diplomatic, right? Like activists for better treatments for HIV/AIDS when it was a pandemic killing people couldn't get traction, especially sympathetic traction. So they formed a group called ACT UP, and they shut down the Bay Bridge, you know? I mean, so I don't think that there's necessarily like a right or wrong answer to it. And I just really want to acknowledge that there's a lot going on that's moving in a different direction than it used to.
I think I saw Ida had her hand up earlier. Ida, did you still want to share?
Sorry, it took me a while to unmute my phone there. Yes, so like today, so for us, it's more over here. I'm trying to get our advisory board provide them a little bit more understanding just how vital and important their role is, other than possibly showing up for that $25 stipend. And don't get me wrong, we have a lot of members on our advisory board that, are there and are, really invested in, or, there for the purpose. Um, but then even though we have, like, for instance, there's a person that sits on our advisory board that, there is person is also on our board of supervisors at time, and I can see that it's like when I'm in there, I cannot, like, I have no like, she has no interest of being there is kind of what I get off of her. But again, that's just probably my own personal, kind of perception that I'm getting. So I'm going to present today at our local advisory board here. And I'm going to present to them also and provide them like training schedules at the CalBH, what is it, CALBHB/C now, all these training sessions and like, how to be an effective board commission. Plus, I'm also going to provide them a little understanding of like, what the BHSA and what it's going to look like and what, of course, using a lot of the information that I'm getting from Access California, and then also what I'm looking also and researching myself here, and how I keep our peers engaged is, so I work at Modoc County Behavioral Health, and I also am the director of Sunrays of Hope. Now, my work at Sunrays of Hope is purely volunteer, and I have been volunteer since 2019 there, and so when there's the CPP planning process, I present it to my peers at Sunrays and let them know, hey, this is what's going on. And this is, this process is I educate our peers and what it is and why it's happening and how your voice really, really matters. Because they're always saying, well, they're not going to listen to me anyways, or da, da, da. And so it's like, well, no, they will. And we just got to watch how we format the words and make sure that we're staying on topic and, getting our point across without coming out like if we're badgering them, but also, also letting them know too that, and, that one project that you guys did, that was an awesome, and giving them kudos on that, in that aspect as well. And not just like all the negativity, but looking at the positive things that have taken place. For myself, like I said, I educate the peers in our center, and there's some that are very, want to be part of it, and some that just like, oh, I don't, I ain't got time, or I'm okay with the way services are going, and I don't want to even be part of that, or, which is totally fine. Everyone has their right to their choices. But that's one way I myself, Sunrays, are trying to educate our board, our peers on the whole changes with the BHSA of what's going on, what's taking place with all the changes taking place. And we also have a template that we had got in a collaboration with Lassen County. Oh man, this was like, I think when the Taking Each Mind Matters started. I think there was a template through the United, I forgot, UACF or something like that, but they had created a template on being able to, how to tell your story. And I can put that template in our the Access California, that coalition that we're all in, and put that template in there along with any other information in regards to like how to tell your story when we're talking about our mental illness or substance use or what in that group data as well. But I just wanted to kind of share what we're kind of doing out here. I probably went off topic. I tend to do that too. But yeah, thank you.
Yeah, thank you for sharing that, Ida, and the work that you're doing up there in Modoc County. I mean, yeah, that would be great to share that template as well with the access program of that.
I will Probably tomorrow, because today my schedule is really, really packed.
Well, we're at 12:05. You want to call it, Joss?
I think we're out of time. Yeah, I appreciate you all being here and the questions and discussions that you brought.
We're going to go ahead and stop recording. And again, the slide deck, link to the recording, and the worksheet that is a guide for public comment will all go out shortly. Thanks so much for coming, guys.